You're watching Medical News Network, your trusted source for the latest in the medical and dental information you need to know. I'm Mike Wittgenstein, and thanks for joining us. Today we brought our cameras to Salt Lake City, Utah, to the offices of Dr. Rodney Gleave to find out about cosmetic reconstructive surgery, the blending of the science of having the proper bite and the art of having a beautiful smile. So if you've been concerned about how your teeth look, maybe you're missing teeth, maybe you just want better overall health and a beautiful smile, then my recommendation is sit back, get comfortable, and I'll see you inside.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Dr. Gleave.
Hi, Mike.
First, I want to thank you for inviting my crew and I to come out today and talk to you about reconstructive cosmetic dentistry. Basically, my understanding from what I've talked to you so far, it's the science of getting the jaw position right, which we now know gets rid of headaches, back pains, all kinds of things, and the art of cosmetic dentistry. What led you to this path? How did you come to start to combine those two?
Well, Mike, probably the biggest thing is just a desire in trying to understand that there's a higher level of care for patient when we get into aesthetic cases. When I first started out in dentistry 18, 20 years ago, I learned the fundamentals of basic care. And through time, maybe after 5 years, I really thought I understood more. But dealing with the more complex cases, especially as we start getting into more aesthetic cases and a higher demand for an aesthetic case, there was more that played into it, and I just knew that there was many things I didn't understand. So I took an opportunity to go back to school and learn a lot of the things I knew I was missing. Through thousands of hours of continuing education, I was better able to understand the relationship of a proper bite when you build in a beautiful smile. And I've probably the last 3 or 4 years taken 300 to 400 hours of CE, specifically on implants and cosmetic dentistry and understanding the bite and all that is accompanies with that. And I've enjoyed it. It's a wonderful experience. I've learned so much. It's richly blessed my life.
Would you say, and obviously when I interview people, I like to educate the public, it's what they should know. Is that an important thing when you go to a dentist? Should you ask him how many hours a year do you do in continuing education?
I think it makes a difference. Certainly the dentists that care more about what they do and are more passionate about the care they deliver take more CE. They want to learn. And especially because, as we've talked about, technology is changing, procedures are changing, the materials are changing. We have wonderful materials today to offer aesthetic dentistry that rival the very best natural-looking teeth.
And that maybe weren't available just a few years ago?
Absolutely.
All right. Time reasons, we got to move along.
Sure.
I want to take me in, show me your office. All right, let me introduce some patients, and let's see what reconstructive cosmetic dentistry is all about.
Great.
Let's go.
I actually researched him on the internet. I went through, you had a little website through just different dentists that do cosmetic surgery, or oral surgery, however that is. And at the time, I really wasn't happy with my teeth. They were awful. They were stained, coffee, that type of stuff. I had dental work done that just over the years from my childhood needed to be redone. So I ended up here just as a consultation, and I think 2 weeks later I was in getting my teeth done.
One is a case that I see quite often and has a complexity of issues, and it's some of the things we've talked about already, where essentially she didn't like her smile, but she also had some stuff going on with the back teeth. So we had to do a combination of treatments, and we're actually, in Wendy's case, we've really only addressed the smile, but somewhat with the back teeth. We've still got work to do with addressing, fully addressing she's got a few things going on with the back teeth that we have to adjust with her bite and restore it fully. But we had to do a few things understanding that later we're going to fix that. But for right now, we just didn't address it. So we've transitioned or done her work a little bit in segments. But I think for now, with her smile, really happy with it.
Very,
Yeah.
very happy. As far as some of the changes I've noticed, I work with the public very closely with people. I don't hesitate to smile anymore. Before you'd smile, maybe people weren't looking, but I always felt like the attention was directed towards my teeth. They were crooked, they weren't as straight as I wanted them to be. So for me to have this done, I don't hesitate to smile. I notice people's teeth, and great smiles, I think, take a long ways. Working with the public, the more confidence you can portray obviously boosts your self-esteem. So I've really enjoyed it.
Okay, now you are a general dentist.
That's right.
Okay, and everybody knows there are periodontists that only do one thing, and there's prosthodontists that only do this, there's endodontists that only do that. What does being a general dentist, because I have an implant. I was going to tell you, I have an implant. Got my implant 10 years ago. It's what got me focused on seeing what implants were. Had my general dentist I went to, he said, oh, we should do an implant. He sent me to a guy that only did implants. That's all the guy did. All day long, just placed implants. And I'm thinking, well, this is great. This is all he does. He'll be a specialist at it. So he put my implant in. I went back to my dentist to get the restorative, the crown put on. It didn't fit. I mean, it fit, but it kind of like gave me pressure. But when I talked to the general dentist, he said the guy that put the implant in didn't put it straight. When I went back to the guy that didn't put the implant in straight, he said the general dentist made the crown, you know, wrong. So now I'm stuck between the two of them, and I don't know. Are you saying that, like a general contractor, because you're a general and you can do it all, it allows you to have a better picture of the beginning and end, that you're able to control it all?
Well,
it's better for your patient. Do they have only one person to explain to?
For me, I enjoy doing a variety of procedures, and I do more complex treatments than most general dentists do because I enjoy it. And that's the freedom of holding a general license allows me to do. But I'm held to the highest standards of the specialists. So if I take on something that is deemed this is a specialty treatment, I'm held
to those same standards?
To the top standards.
Does it give you, in my own situation, you know, and again, I don't think I go through anything different than everybody out in the public goes through. Does it give you the ability to, I don't know, make the patient more comfortable? Because the patient has nobody to, it's just you if something goes wrong.
That's right. Well, part of why I enjoy doing a variety of things and being in charge of kind of the whole case and managing the whole case is that ultimately I'm responsible for everything. Also, I found through the years that patients really appreciate working with one office versus going out to here. There's a number of patients in the past I used to say, well, you really need this treatment, let me send you over somewhere else. And they'd come back next year, it wasn't done. Then, you know, then 2 years later, it wasn't done. Well, why isn't it done? I didn't want to go somewhere else. I want you to do it. So it forced me to get back into school, to learn these complex treatments and spend the time. Take, for instance, implants. I really enjoy taking care of a whole implant case and really feel confident now in my abilities to treat it, as well as a specialist, because of the training and the extra effort I've put in to really understand it and treat these procedures.
What do you like best about what you do?
I would say, for me, the thing I enjoy the most is really helping patients. That's a key reason why I got into dentistry in the first place. I wanted to be in the medical profession. And I looked at all the different medical disciplines. I chose dentistry over a lot of medical professions because of the ability and freedom it gives me to work with my hands. And I love the artistic part of dentistry. But ultimately, it comes down to the patients. I want to improve someone's life.
Before, I didn't smile as much. I don't think that I was totally confident in my smile, and I would see other people smile, and I'd go, wow, I wish I could, you know, have one of those. And finally got down to do it, and it's been an amazing emotional booster for me, and it's meant that I can really smile and express myself a lot more, and I just feel more confident.
Yeah, it was a fun process actually to go through, to pick out your own teeth. I mean, what a concept, right? You know, you get to pick your own teeth, and looking at the different styles of teeth and how your smile might be different depending on what your choices are. Wow, that's my kind of shopping, you know? For better or for worse, in our culture, beauty is power. And